My name's Vanessa Elliott. I'm an assistant professor of surgery in the Division of Urology. I specialized in female urology and voiding dysfunction. I was totally inspired by my mom. I had a mom who has chronic illness my whole life as I was growing up. My mom was always this really tough person who had this drive, and she never gave up. Growing up in our household, there was no, you didn't give up on anything. You worked your hardest, you just stuck it out, and that's what you did. When I went through medical school, I had a mentor here who was a urologist, and I was with him one day seeing patients in clinic, and I saw all these poor women who were having problems with incontinence, and they were telling these stories of how they've suffered for 10, 15 years and were too embarrassed to talk to their doctors. That's kind of what drove me into urology. I see people at all different ends of the spectrum, but most commonly here, I tend to see patients who have tried a lot of things and haven't had a lot of success. Maybe they've had a few surgeries even before they've come to see me. InterStim therapy is a treatment option for urgency, frequency, and urinary incontinence. It's a trial therapy. You get to have a small procedure done, whether it's in the clinic or in the operating room. You get to try the device for anywhere from 3 days, depending on how you implant the leads, to up to 3 weeks. And you get to see if you like it. And if you do like it and you have good responses to the device, then we permanently implant basically a pacemaker type device. You live your life with that device turned on, and it lasts for 3 to 5 years, and just as if you had a pacemaker for your heart, you would have the battery changed every 3 to 5 years. It's such a small procedure, but they get such a huge benefit when it works for them. So some of my patients come to see me and they're exhausted because they wake up every hour at night, they never get any sleep, they're going to the bathroom all the time, they're incontinent. It can be life-changing in the sense that they might get a full night's sleep. They may not have to get up from their desk 10 times a day to use the bathroom while they're at work. A lot of women who see me, they don't know if they want to go through surgery to fix something like incontinence. So when they come back and they say, I wish I would have done this 10 years earlier, it makes you feel really good that you did something to really improve their quality of life.